we now move on to our next session on digital adoption and transformation for the future, CEO's perspective. Joining us today for this discussion, we have Dr. D.K. Gupta, Chairman, Felix Hospital, who will be moderating this discussion with us. May I request the presence of Dr. D.K. Gupta, Chairman, Felix Hospital. Welcome, sir. Can we have a round of applause, please, for Dr. Gupta? We are privileged to have the presence of Mr. Satish Kidugu, Chief Executive Officer and Director, MediAssist Healthcare Services Limited. Welcome, sir. We are also honored to have the presence of Dr. Sachin Bajaj, Founder Director, Ujala Cygnus Hospitals. Welcome, sir. May I request Mr. Piyush Arya, Chief Growth Officer, Ogneto AI, to please join us on stage for the discussion. Welcome, Mr. Arya. Sorry. Yes, please. Can we have more chai? My apologies, please. Just two more. I'd also like to welcome Dr. Charu Dutt Arora, Founder Consultant, Asian Institute of Medical Sciences. Welcome, Dr. Arora. Thank you so much for joining us. A round of applause, please. I'm handing over the session now to Dr. D.K. Gupta to take it forward. Over to you, sir.
Thank you so much, and I welcome all of you on 10th Elets, this summit on radiology and imaging and innovation, basically. And I think after COVID pandemic, these things should now regularly happen, otherwise we will be quite away from that latest development in the industry. And I welcome Dr. I think this topic for this session is transformation. Topic for this is digital adoption and transformation of the future, CEO's perspective. मैं दोबारा बोल रहा हूँ, digital adoption and transformation for the future, digital adoption and transformation for the future, CEO's perspective. I will be moderating this session, and with me is Mr. Satish Gijju, Chief Executive Officer and Director, MediAssist Healthcare, and Dr. Sachin Bajaj. I think we all know Dr. Sachin Bajaj. He is a Founder Director, Ujala Cygnus Hospital Group. Piyush Arya, Chief Growth Officer, Ogneto AI, and Dr. Charu Dutt Arora, Founder, Member and Head Consultant, Asian Institute of Medical Sciences. So we welcome all of you, and I think we will start this session. The session, we all know that there is a huge transformation in the industry. Especially we talk about the digital transformation. In this post-COVID pandemic era, we know that there is a huge change in perspective of consumer, especially healthcare consumer. Everybody now needs convenience, they need affordability, they need accessibility, round the clock for the healthcare services. With all these things in mind, we will start this session. And if we start this session, first I would like to brief about the healthcare transformation in the digital era. In current scenario, current time, in 2022, the total value of this digital healthcare is around $150 billion, around 144 to be more specific. And we are projecting this in 2026 around 444, but it will be growing at 18% of cumulative annual growth rate. This is in one perspective. If we talk it some data sources from other data sources, it will be growing at around 28.8% of CAGR, cumulative annual growth rate. Means currently it is around $250 billion, and it will be growing to $880 billion by 2027. So it means there is a huge scope, and everybody needs now digital transformation. And after COVID, we have seen lot of things. Around 50 million teleconsultation had happened in last 2 years. It was around 10 million before that, means around 4 times growth in teleconsultation only during this COVID pandemic. So I will start from Dr. Sachin Bajaj. Would like to ask one question, that what is the current scenario of digital healthcare in India, and what will be the vision of this digital healthcare transformation in India? Thank you so much.
Thank you very much, sir. And it's always a delight to come to Raviji, but always an issue that, when we have manners, it is very difficult to promote anything on social media because you get so much blowback on it that if you post anything like this on social media, people will be cursing you rather than praising you on whatever you say. So digital health, of course, we've seen it has undergone a great transformation in the last 2 years. I was very, very fortunate to be a part of Project Step One when we started it as a small WhatsApp group when the lockdown was starting, and the WhatsApp group was called Founders versus COVID. I was the only doctor founder there. There were all other techies. We did understand that something big was coming and it would be difficult for governments alone to manage that. More and more people joined, and we renamed it to Startups versus COVID because there were so many other people other than founders there as well. And then finally, the name was called Project Step One. At the time we started this, telemedicine was actually illegal in India. So we were doing something very illegal just to manage the pandemic which was coming in. The telemedicine guidelines were launched soon after, and that was a great relief for us. At the peak of the COVID pandemic, there were 11,000 doctors volunteering on this platform, which was completely virtual. I haven't met most of the core team also even till today, let alone all the volunteers that came in. There were more than 3,000 other volunteers who were techies, who were back-end, who were managing the process. And Project Step One worked with 21 state governments managing the pandemic, right from COVID consultations to triaging to plasma bank operations to now vaccine ushering as well, home isolation monitoring. And we did more than 9.8 million calls on that platform, completely free of cost for everyone, for the governments as well as for the patients. So out of the 50 million, 9.8 million were being seen directly by us, what was happening. I was the first one to start calling myself because we had no volunteers at that time. But what digital transformation over the 2 years showed us that people are willing to do good if you just give them some platform to do it. Here were 11,000 doctors volunteering on this platform, working like call center agents, listening to diatribes of patients, listening to them vent out on them. And it was not just healthcare that was being vented out. It was, I don't have medicines at home, घर पे ताला लगा हुआ है, कोई पूछने नहीं आया है, मुझे पल्स ऑक्सीमीटर नहीं मिल रहा है, कैसे आप मैनेज कर रहे हैं? And these were all doctors listening to all these complaints because they were calling on behalf of the governments. So after that, we understood that this behavioral change that had come in was very sticky. It was difficult to wean patients off the comfort of calling the doctor anytime, talking to them. It was not that you had to take out a car, go travel half an hour and then wait in the doctor's cabin for another half an hour. It was an amazing thing, and we put out a offshoot of Project Step One called Medfo. And Medfo is now doing, although it is a paid service in many aspects, the teleconsultations continue to be free. But many other things are paid. So we are doing more than 15,000 teleconsults every month, even on Medfo, even though we are focusing only on rural areas, the hills of Kumaon, the hills of Kashmir, where we work in a brick and mortar model also. But we see that offering these services brings down the cost of the disease massively. As sir sitting right next to me understands that once the patient comes to hospital, his cost of disease has already gone up, right? And sir actually is wrong in the way that he only measures the direct cost of the disease. So the direct cost of the disease is the lowest cost of the disease. If, for example, we have 77 million diabetics in India, we know that 1/3 of them will go into kidney failure, for sure. We know that we are amputating 1 foot per minute due to diabetes. Every minute we are amputating 1 foot due to diabetes. So if the patient comes to us, we can pat ourselves on our back that okay, he had Medi-Assist insurance, so he did not have to pay out of pocket. You know, the insurance company paid for him, or the Ayushman card paid for him. He came to our hospital. It is a very low-cost hospital. It is near his house in Kashipur or Haldwani, and that is why he saved money instead of going to Delhi and spending lakhs of rupees. But is that the real cost of the disease, the amputation for 30,000 or the dialysis for 2,000 rupees? That is not the real cost of the disease. Because he's in kidney failure or because he's lost his foot, he will lose his job, he can't go and work in the factory. So his future earnings that are lost are running into lakhs and lakhs of rupees. And the scariest part, of course, is because he's lost his job, he will pull his children out of school and send them to work. So future many generations will be destroyed because this patient did not have the time or the luxury or the money to climb down from the hills and come to one of our hospitals and see the diabetes physician. Now if we can offer him this on a call, which he can do anytime, or on an app, or on a device that he can afford, it transforms the nature of disease management completely and really switches the focus from sick care to health care. Right now the problem in India is we are only doing sick care. 91% of our funds are going towards sick care. Only 9% go to preventive or primary care, which is the saddest part, right? And that is why the cost of the disease are
digital
ballooning.
transformation? If we talk about the care, like healthcare is divided in primary healthcare, preventive healthcare, secondary, tertiary, and now it's quaternary healthcare, even palliative, geriatric care. So what is the future? Like if we have a full digital transformation in healthcare sector or healthcare industry, then how it will be seen after 5 years or 10 years?
So the future, I think the immediate future we are looking at is definitely a large shift towards preventive and primary healthcare, because consultations will be available so easily. People will have access to consults, and insurance providers are also switching more towards primary care and preventive care rather than just in-hospital sick care that they were looking at. And in the slightly distant future, I think we are going towards more personalized and predictive healthcare, which I think Israel has done very well till now, and we are all looking at it. So if I see that today you have these 3 risk factors along with diabetes, your chances of going into kidney failure 20 years down the line is 10x more. So I will focus more on these patients rather than the ones who did not have those risk factors. So I think these predictive and personalized care is coming up in a big way. We are looking at it now as well.
Great. I think if you will agree with me also, in future, I think 10 year or 5 year down line, people will come only in hospital for their emergency procedures or surgeries, emergency treatments, or quaternary or tertiary care treatment. For preventive health care, primary, even secondary services, palliative health care, they will be all provided at their homes. And the digital role will be quite high in these all modalities, all these channels. I think that's a major point. Thank you so much, Dr. Suchin Bajaj, founder, Cygnus Ujala Group Hospitals. Now my question is to Mr. Satish, Chief Executive Officer and Director, Medi-Assist Healthcare Limited. And my question is that how the insurance industry transformed themselves during this COVID pandemic, and what is their future vision? If there are so many digital healthcare aggregators are there, so many Pristine Care, Procteo and Camelio, and there is one more, I will not say barrier, but there is one more player, one more service providers, one more vertical has come between the hospitals and the insurance companies. And being patient-centric, insurance will play what role and how they will play this role during this digital transformation era?
Thank you so much for that. Thank you, Dr. Bajaj, for that very insightful information on healthcare. See, healthcare costs continue to be the most catastrophic reasons for people going bankrupt, right? And that's a universal truth. And it is even more so in India, with an estimated nearly 62% of all expenditure is out of pocket. despite the country being so large, we, for 130 crore odd citizens, we have less than 60,000 crores of health insurance premiums that are actually booked today, right? Someone finally has to take care of the costs and the financing. If all of you as doctors are magicians, it's our job to, manufacture the props, make sure we organize the crowds. But, someone's got to do that job. And I think clearly the last 2 years have shown people that, one, the traditional channels of healthcare delivery that the insurance was used to have got disrupted, which meant home care, digital health, preventive, outpatient, services, which were earlier, let's say, not really big part of insurance covers in India. You've seen the way the benefits have significantly evolved in the last 2 years, where, in fact, corporate employers encouraging their employees to use digital health, and simplified access to diagnostics, in the hope that the catastrophic care incidences will actually come down, right? And I think that's one big change. I think the second big change that happened was that while you were struggling to treat patients and manage, we were equally struggling because we were used to certain kind of process, getting certain kind of documents, certain kind of evidences, certain kind of reports. And I think the industry has significantly moved. And I think approximately 27,000 crores of COVID claims were paid. While it's a small number in the country, but the industry really stepped up to make sure that at least during COVID, nobody was left without money at all, right? I think that's a big thing that has changed. The third, I'm hoping that will stay forever, is we have simplified a lot of process to be digital ourselves. So in the last 2 years, nearly 90% of the payments that we have enabled for hospitals, we didn't ask for paper. I mean, it just moved away from paper. We are now able to just say, listen, go ahead, submit a copy, give us some data. And that really enables the ecosystem to run well. And I look forward to a day as we move forward that patient is informed, not just on what to expect from a medical side, but from a financial outcomes perspective. They are well informed before they walk into the hospital. On the day they're ready to get discharged, there is really no discrepancy between what they knew and what they've actually experienced from a financial perspective. And the hospital actually gets money in 24 hours from the time the patient actually walks out. And I would think if there is one transformation that I'm hoping that will stay, it is that.
Great. My second question to you, like we all know that within next 5 years or 10 years, there will be a digital transformation. It is an ongoing process, and most of the primary healthcare services, secondary, and even tertiary, even palliative healthcare services that we have will be shifted from hospital to home. Are insurance companies going to this cover in the insurance, or they will be out of that? And what will be your perspective for this change?
Thank you. Since I'm not the regulator, I'm not going to give you an affirmative answer. But I believe the way we have seen things change, God forbid if there was the third wave was as severe as second wave, the world would have seen even more catastrophic changes. And I think the second wave really taught us that you can't rely on everybody being available at all times. You need scale, even if people are unavailable. You need efficiency because you don't have people being able to dedicate as much time. And finally, it's not hospital versus insurance, because finally it's one patient who needs both financial and healthcare outcomes, right? And I believe the insurance industry is equally cognizant that if we don't participate in the journey of how healthcare journey happens end to end, we may pay, but we may never heal the patient's problems.
Thank you so much. And now my question is to Dr. Charu Dutt Arora. He is a founder, member, and head consultant, Asian Institute of Medical Sciences. During this COVID pandemic, we know that there were a lot of digital transformation. What was the role of doctors, how they reacted it, how they adapted it, and what is their future contribution to this digital transformation?
Thank you so much, Dr. Gupta, for this question. I think this question is very intentionally directed to me because yesterday a lot of people told me that it's nice to have a doctor to tell the reality about doctors to a lot of people here. And heading the department of a home healthcare department inside a tertiary care hospital, which handles more than 1,200 inpatient beds, has been a very difficult work. And to be honest, our work in the home healthcare department revolves around digital transformation. Our work does not involve seeing patients personally most of the time. Our work doesn't involve all the healthcare personnel going to the home and seeing the patients because it's not feasible. It's just, it's impossible. So in the last 2 years, even before that, the home healthcare was one of the verticals of healthcare industry which was a risk taker, which had a flexible mindset. And the doctors who were involved in this vertical were pretty flexible to, to kind of augment technology for a more seamless and continued integrated approach for a better outcome of healthcare to the patients. Now, because of COVID, the other branches had to adopt it. The other branches had to face because, there was no other option. But did they really like it? I don't know about it, because as the COVID is settling down, as the pandemic is settling down, most of the branches of the medicine, even inside the hospital, are going back to their previous primitive ways of working. The patients are still liking the adaptability because they love the cafeteria approach. They love the on-demand way of healthcare. They want the doctors to see them at their own convenience through a wearable device or a handset or a more mobile way. But the doctors are still stuck on that mental stigma, most of them, that they want to see the patient. They are still not adapting the blockchain technology. They are still not adapting the AI, virtual reality, most of them. So I think education and awareness is the key. The new doctors, the trainees need to be taught about, more technological innovations, more virtual reality programs, more about machine learning and big data. And slowly and steadily, this is going to change. But now, because the topic of our discussion comes from a CEO's perspective and founding an organization, my personal thing is the authenticity and the credibility of the software makes a huge change. These are fancy terms, and as the fellow colleagues who are so senior to me have talked about the big numbers, in trillions and billions of dollars, in India, trust is a major problem. Every second person sitting in Bangalore or Hyderabad or even Gurgaon for that matter is coming up with a startup. So these are terms of the century: startups, big data, AI, healthcare, technology. But what is the authenticity? Which software should a CEO put his money in? It's like a karma. If I put my money in the right software, only then it's going to give me a return. Otherwise, if I'm not a risk taker, if I'm working well, I'm happy with handling just 1,000 patients in a month, giving them my pen and paper prescriptions. But putting my money and not finding a return back, not being able to understand, oh, the startup got shut down, I don't want to take that risk. So the credibility, the authenticity, the accreditation by a regulatory body, and with kind of a better outcome, to educate my trainees in terms of all verticals of healthcare, starting from a caretaker who's a 10th pass person to just take care of the private area sanitization of a patient, or taking care of the feeding and the motion cleaning, to as complex as an ICU doctor. Everybody needs to be trained in handling these softwares. And just to add on one point, my personal experience in the last 2 years has been that the senior care population in India is much more receptive and sensitive towards understanding these softwares. We handle more than 600 senior care people every week, and we have started, with the help of one of the largest regulatory national senior living associations in India, about teaching what is the importance of having a pulse oximeter or a step calculator or a single application on your mobile phone, which turns your data into an objectified clinical outcome.
Dr. Charudat, can I interrupt? What will the future doctor will be looking like after 10 years? If we talk about the one clinician who is now busy with that, dealing patient, taking history, doing physical examination, writing prescriptions, doing rounds, and again visiting for the OPDRs. And this is current scenario, and still there is transformation going on. If we talk about the future doctor of globe, future clinician, how will we look like?
The future physician or the future clinician will be something called as a phygital. I call it the term phygital because it will be a combination and amalgamation of physical with digital. The physical component will be more humane. The person who's actually responsible to give a touch to the human or human body will be actually giving that time. So the actual time will be used only for the things it has to be used, whether that is a wound dressing or an IV infusion or a counseling, a bereavement session, a palliative care specialist, a physical therapist, a chiropractor. These will be the areas where a human touch will be required. But the digital aspect will be something a doctor can do just by using technology. So the human concept is not going to be replaced, but yes, the humane concept is going to be more, and the time consumption will be less. So better outcome and understanding the concept of physical with digital.
Great. Thank you so much, Dr. Charudat Arora, for elaborating great things about the doctors, clinicians, and their future role in the digital transformation era. Now, my next question is to Mr. Piyush Arya. He is a Chief Growth Officer of Ognito, and that company deals in the EMR, electronic medical records. And I think if we talk about digital adoption and transformation for the future, it means the EMR, HIS, and other technology-enabled softwares and their services will be one of the key role players in this transformation. If we talk about this digital things and digital health, that includes like online consultation, video consultations, EMR, telehealth, telecare, like wearables and devices, and HIS, LIS, CRM. There are like this online queue management, online appointment management, even integration with different devices, different softwares, different like websites, even some social media marketing. It needs lots of work on this area, because as a hospital provider, I have some pain areas regarding the software technology or software development, because we don't have a complete solution right now. If we talk about, we have to buy HIS separately. If we want LIS good, then we have to buy separately LIS. Like if we want to have good pharmacy, then we have to develop good software for pharmacy. We don't have a good CRM in the healthcare industry right now. And if we talk about CRM, then there is a lot of difficulty in integration of these different software modules with HIS also. So what is the future HIS? What will it look like? How will you solve our problems, our pain areas, our difficulty, so that we can provide best patient experience, we can improve our operational efficiency, and we can like train our users or train our like workers, employees, so that they can have user experience good also.
Thank you so much for that query and context. Also, thanks to the organizers for putting this together. It's a pleasure to be here. I think, with due respect, just wanted to, level set. We're not an EMR company. Ognito is essentially a voice AI product, and it helps drive adoption of various clinical IT systems, EMRs being one. I do have a point of view to your specific question of what the future of EMRs and HISs would be. I'll probably come to that, but in my endeavor to answer that, let me just try and deconstruct, a few topics that have come up on this one. I think Dr. Charudat just mentioned one comment in his last remarks there about how, as a CEO, do I select the right software? How do I invest in a software, right? Now, if we were to now look at the broader perspective of the provider, the payer, the patient, everything, all the innovations that are happening, and fabulous panel here. You're just getting payers, providers, and everybody, and technologists like myself also here. I think. As a CEO, from a payer perspective, some of the challenges, Satish, that you called out, which are, how do I get, faster claim processing, complete medical records? How do I not have to challenge, hospitals and providers when they're sending across records and be fairly, faster throughput of processing claims, and thereby, on the provider side, discharging patients much faster, driving some of those operational efficiencies, and purely from a patient aspect, the experience that you would get in working with an organization or going into a healthcare organization where you're being A, given the best clinical care, B, being treated with respect, dignity, and being treated like somebody who matters to everybody at the core of what we do. And I think Purely from that architecture framework, if I were to say how we select a software, one part is some of the core metrics that a buyer or a CEO would look at, right? You're probably looking at revenue. You're bound to go off the top line. You're also looking at a P&L and thereby the bottom line. The fact that we are working with physicians, you also want to drive physician satisfaction, physician efficiencies, and purely from an operational aspect, how do you really run the hospital or the healthcare setup, whether it's primary, secondary, or tertiary, in a very well-oiled, almost like a clockwork precision manner. Now, I think when I now do the segue to the role that HIS softwares, EMRs play, one thing is pretty much from a digital transformation aspect, just having those softwares in there, right? I remember about 5 or 7 years ago, before COVID hit, we used to promote and talk about things about interoperability. We used to talk about FHIR, HL7, DICOM, and the big challenges that CIOs and heads of IT and therefore the management of hospitals that were struggling with was, my data is stuck up in so many disparate sources of all of these clinical IT systems. It doesn't talk. How do I really navigate through a longitudinal care record for a patient to be able to take the right decision for the patient in that encounter at that point in time? I think COVID has taught us that technology can do that job, right? And I think that is table stakes, that is out of the equation right now for the future. Now, let's say the systems are already in place now. From a CEO's perspective or from, let's say, the financiers or the payers' perspective, now we're talking about saying, how do I drive outcomes and ROI? Now, from system provisioning to driving outcomes and ROI, there is a complete paradigm that we need to transgress. And one of the first stages is really, I think this was a conversation that came up even with the previous session that Dr. Meenal was facilitating. How do you drive adoption? How do you drive adoption of softwares? And in context of, let's say, EMR, if you put in the right and relevant data at the point in time when you're discussing it, diagnosing it, rather than hand it down to the RMO or the nurse who's going to go to a nursing station, put up data into an EMR, purely from an efficiency aspect. Let me give you a future art of the possible. As a clinician, you're walking around in your morning rounds, you're at the bedside of the patient, you have a great EMR and an HIS and a clinical IT stack in your hospital that works really well. While you're on the bedside, you've held up this thing, you're just saying, I just saw this patient, he's able to walk, he or she is able to walk 100 feet on day 3 post-cabbage. Everything looks okay. And I'm not a doctor, so I can't be as prescriptive. But imagine all of this is done, and you're saying this patient probably needs just a quick diagnostic test. If the results are okay, ready to discharge. Now, purely from driving efficiencies, imagine this being discussed at the end of that particular round, somebody scribbling it down on a piece of paper, a few minutes, half an hour later, it actually gets ingested into the EMR. As long as your systems are all interconnected, an order gets placed into the LIS for a laboratory, this thing, somebody is, coming in to draw the sample. Compare that to what the future could hold. The minute you speak into your EMR, your EMR is now interconnected with, I don't know if it's an imaging, thing to be done, if it's an LIS, which is firing the order, some work list is maintaining. By the time the doctor gets to the second bed, all that orchestration has happened at the back end. And, a ward boy comes saying, sir, would you like to sit on the wheelchair? We want to take you in for a scan. By the time the doctor's finished with the bed, the 4th or 5th bed on the morning round, for all you know, the decision is already done for the patient. The previous session was talking about how the role of technology in driving faster decision making for diagnosis and reporting can really be accelerated. So I think that's really the future that we want to head to. And therefore, one of the things I'd actually want to throw back to CEOs like yourselves is, when you go around making choices about, one thing is how do you choose the software to buy? The second is, do you look at investing in software as a cost center, or do you look at it as an investment into future value unlock? I'd love to get probably your points of view, if you would.
If, as CEO's perspective, if I talk about the software, then I need first thing that there should be super wow experience for our patients, from online registration, online appointment, to walk in the hospital for the queue management, doctor consultation, doctor prescription, and medicine delivery, home sample collection. Everything should be interlinked, and they should provide best of the best experience for the patients. Second thing, if we talk about our hospital doctors or paramedical staff, then doctors should be empowered to take decision fast, accurate decision. The EMR should help, AI should help actually for helping in the diagnostic based on the symptomology, based on the physical examination, based on the test they have done, based on their past history, and then they should suggest what is the probable diagnosis, what can be the rarest of rare diagnosis also, how they can give offer best of the treatment to this patient, what will be the outcome of this disease. So if they are empowered with the AI and this HIS system or their electronic health record or EHR, then definitely our doctors will be happy. If I talk about my hospital staff, so their operational efficiency should be high. They should know what thing to do, at what time. That turnaround time should be reduced. Their the software should be user friendly. We should optimize, cost optimization should be there. Operational efficiency should be improved. We can track where our nursing staff is right now, what they are doing, how we can improve our operational efficiency of the GDA staff, ground staff. All these things should incorporated in a HIS or EMR system or any software that should incorporate, or even CRM. We should know, we should have a good CRM, great CRM. Even now if we talk about the service center, car service center, they are having great CRM. You got message, you got feedback. These CRM should be integrated with the HIS. They should tell their patients what is their next appointment, when they are scheduling, they can reschedule it, they can ask their questions, they can book appointment, they can give their review, they can give their feedbacks. It has to be, there should be good MIS reporting from this system so that CEOs can have better look how they can be decision making for the CEOs actually. So I think these all things we require from CEO's perspective. Anything else you want to contribute, Dr.
Yeah, I think the most important part when we are deciding a software is that we should take all stakeholders on board. Unfortunately, that's never done. So if you take feedback from the IT head, the finance head, the business analyst for the software, it will always be very good, awesome, very good. You take the same software's feedback from the nurses and the doctor's horrible, doesn't answer anything, it's so bad, it takes so much time. And unfortunately, none of us even think that the patient is the most important stakeholder. So he has no say when I am buying the software, which is the most unfortunate thing. So if you have patient representatives along with nurses and doctors when you are deciding on the software, I think most of the requirements that Dr. Gupta wants will be answered for themselves, because they will point you out even the smallest of the things that this should be there. Why are you not thinking about this? Because sitting in a corporate office, it's like, as I love to call it, it's like the watermelon effect, right? I'm seeing everything from 20,000 feet. Everything looks green from the outside because the watermelon is green. But as soon as you jump inside, it's all blood, it's all red everywhere. And you miss it because you are sitting so far away from the ground. So I think the stakeholders should have a large say when we are deciding.
I think one thing more, like there are several modules, different modules in a HIS. And I think no company has one of the best solution for the healthcare providers. If you talk about the one solution, they will have one good module. It can be a clinician module, it can be lab, diagnostic, pharmacy or anything. But we need HR also, we need accounts also, we need finance also. So we have to integrate with Tally, we have to integrate with Grey HR or something like that. So even there is a lot of problem in integrations also. So we need one complete solution. At least it should solve around 80% of our problems, and 20% problems can be solved by the good integration from the different other softwares.
I think that's a great point, Piyush. First of all, I'll be very honest in saying that yes, it has to be cost-centric. I will not, what Dr. Gupta just said, it's extremely ideal. He has put all from A to Z, he has put all the points which should be. But that doesn't really happen. Now, sitting at a chair, I have to think whether the software is cost-centric. Most of the softwares which we have invested in, we have not been very pleased with the post-buying service of those companies. Because, Dr. Bajaj is absolutely 100% correct in keeping all stakeholders correct. But before the software has a meeting with us, before any company comes to us, before a startup comes to us, the meetings happen in a very gradual, pleasing, rosy and too rosy manner. But after we are done with it, there's no service because the pharmacy team or the back-end team or the team which is working day and night for the patient, they need to contact the software organization and the technologist for any kind of a service for that approach. So that seamless, hurdle-free, and 24/7 operational service center approach from the technology has to be there rather than just thinking about it, because that one night of a disaster fails everybody. So that entire money goes into the drain if that one call of that one service is not attended by the team. So I think that cannot be ignored.
Also, one thing more, like there are so many new companies are coming in software development in the healthcare industry, and data privacy, data transfer, data accuracy, data analytics, these are the one new challenges and new problems for the healthcare players, healthcare providers, so that we can have a great trust on these HIS companies, or there should be some regulation or accreditations so that it can be sorted out, it can be, like we can trust it upon these companies.
Sure. I mean, I absolutely loved all these comments. I captured about 4 things from all.
A lot of bombardment.
No, I love this because
It
as a
seems that
decision
Piyush, you're moderating this session, huh?
I'm really sorry about that. But I think I captured 4 things, that I heard. User-friendly was one thing I heard. The second one was, Dr. Charu, you mentioned customer service. I heard, Dr. Bajaj, from your perspective, involving all stakeholders. And the last thing that you mentioned, Dr. Gupta, was privacy and security. I just wanted to make sure, I just talk a little about Ognito as well. We come with almost 22 years of clinical documentation experience. Running a BPO, so customer service is almost inside our DNA at the moment. The one thing on the last one on the privacy and security, I know that's a topic that is not very highly regulated in the Indian ecosystem at the moment. But the minute you advance, towards the West, in the UK, US, HIPAA, GDPR, that just really defines gold standards. And I'm proud to say that, as a fairly young organization coming out of a services background, we are GDPR and HIPAA compliant. So I think from our perspective, we totally get that. And then at times, I know Rustam also spoke about this, earlier yesterday. He's our co-founder and CEO. At times, we are in some way also educating, the various stakeholders in the ecosystem about all the paradigms that they need to be thinking through. And I think the last thing I really want to talk about is, you mentioned the stakeholders. On the user friendliness side, it's been very pleasing over the last day and a half, that we've been sitting in this room where, we've had our customers, whether these are, IT heads, who've, bought into the software, whether these are physicians and doctors who are using it. It's almost, table stakes for us when we talk about, just involving all stakeholders and building user-friendly software. So I think glad to hear that these are all the decision-making criteria, and even gladder to think that, we've actually been leading on all those counts. So thank you for this opportunity.
I think thank you so much, and we want to summarize it here. And if we talk about digital transformation and adoption, definitely it is a great thing, and it has already been started at a great pace. And after COVID pandemic, I think everybody is adopting, in starting from the consumer, doctors, paramedical staff, clinical staff, non-clinical staff, even housekeeping, GDS, they are adopting the system in the process of the IT and the online transformation. So I think that great start, and we are looking forward for the solution of our problem from the IT industry, so that we can be more empowered as a clinician, as a CEOs, as a CFOs, or as a Chief Growth Officer or marketing person, and definitely we are looking forward. Thank you so much. Thank you, everybody. Thank you so much.
Thank you. Thank you, Dr. D.K. Gupta and the other fellow panelists. It was a wonderful, engaging discussion. I think you've set the tempo for the day, and we are very thankful for your presence. So may I now request Dr. Ravi Gupta and Dr. Hira Lal to again grace the stage and present our esteemed panelists with a small token of appreciation from our end. So I'd request Dr. Gupta and Dr. Hira Lal to present the memento to Dr. D.K. Gupta, Chairman, Felix Hospital, for the wonderful orchestration of this discussion. Thank you so much, Dr. D.K. Gupta. A round of applause, please. A memento for Mr. Satish Gidugu, Chief Executive Officer and Director, MediAssist Healthcare Service Limited. Dr. Shuchin Bajaj, Founder Director, Ujala Cygnus Hospitals. Thank you so much. Mr. Piyush Arya, Chief Growth Officer, Ognito AI. Thank you so much, Mr. Arya. A round of applause, please. And Dr. Charudat Arora, Founder, Member and Head Consultant, Asian Institute of Medical Sciences. Thank you. Thank you so much, sir. May I request for a group photograph with the eHealth magazine that's been catalyzing healthcare innovation since 2005 and featuring leading policy makers and healthcare leaders through its various editions. Thank you. Thank you so much, esteemed panelists, for your presence. Thanks a lot.